First at 5 o'clock, the future of Medicaid for thousands in Michigan.
The state health department says 750,000 Michiganders could lose their benefits under what the president calls his big, beautiful bill. Today at the state capitol, advocates spoke to state leaders about what could happen if the bill, already approved by the U.S. House, is passed by the Senate.
13 on Your Side's Lauren Baker was at today's hearing in Lansing and heard the story of two Grand Rapids area mothers who say Medicaid must stay.
Before today, Melissa Fosberg and Courtney Gilmore didn't know each other. But after hearing each other's stories, they say they found a connection in their fight to keep Medicaid, not only for themselves, but for families across Michigan. Miles away from the U.S. Capitol.
My son Jace was born with a rare life-threatening condition called hypoplastic left heart syndrome, otherwise known as half a heart.
Two Grand Rapids moms spoke at their state capitol.
It was too late to do an emergency C-section, so he ended up with brain damage due to a loss of oxygen.
Fighting against cuts on Medicaid.
It allows us to be a mom and not just, when he was little, it felt like I was his physical therapist, his speech therapist, his feeding therapist, and when did I get to be his mom and not just a nurse and an advocate.
Melissa Fosberg and Courtney Gilmore didn't know each other until Wednesday.
Even though we didn't meet till today, we already do kind of know each other.
Until the two heard each other's stories during the Michigan Senate Health Policy Committee hearing, a moment they say can be comforting.
Even though you don't know each other, it's kind of nice to be able to relate to someone, especially coming here by yourself.
They were joined by other agencies and advocates voicing concerns about federal cuts trickling down to the state level.
Medicaid not only improves health outcomes, but actually increases educational attainment and future wages.
Some lawmakers agreeing with what was being said.
You're cutting the funding coming to the state for Medicaid. You're increasing the cost for us to administer the program. And the ultimate end of that is that less people will have coverage.
Megan Groen, Chief Deputy Director of MDHHS, says 1 in 4 families are covered by Medicaid, many of those families living in rural areas that heavily rely on Medicaid, which is why these moms say their fight to keep Medicaid isn't just about their boys.
I'm proud that I get to do something.
It's about making sure every family that relies on Medicaid can help keep their loved ones safe and healthy.
If I can help, just be a little bit of help towards saving health care for children that rely on it to live, that is worth it to me. No matter how nervous you are, it's worth it.